what you just said is absolutely correct. And to vouch on that, if we have come across something that as a nation we all have actually seen, is the introduction by the Ayushman Bharat for a national digital health ID. Now we have to understand where these national digital health ID are going to go and what are their effects. So these health IDs are going to be created and be deployed on central systems. And this is going to connect our health data across different institutes and clinics that are actually going to use it. So this basically works as one of the primary understanding of how cloud computing in the coming era is actually going to change the way we perceive healthcare. Secondly, and one of the most important aspect to understand is the introduction and the development that is happening around us in artificial intelligence. Anything that is actually happening in artificial intelligence space requires a huge computational power. And for any small or big institute, it is not that easy to actually go ahead and buy such an infrastructure. Such infrastructure could only be managed, maintained, and refreshed by a organization that could take care of that. And something like Amazon could actually do that. So this certainly help us to go along the path where the healthcare could benefit out of this, managing and reducing the infrastructure size. So if you look at just in the aspect of artificial intelligence, three products that have matured really good in the past decade are under image processing, where we see a lot of radiology work is being given to the AI to basically go ahead and provide detections of early stage cancers, where different variations of that, or early stage diabetes at times as well. At the same time, any decision support or patient triage has also been done by these AI models, which are very mature and has been used in outside India, and now it's basically coming in India as well. So these application requires a good computational power, and these computational power certainly comes from cloud computing. On top of that, in healthcare, we see over 5 million different touch points, and each touch point can actually be part of our medical data that could be mined by big data. And for that, again, cloud computing work as the basic structure to take it forward from there. When we look at the investments, just investment is not a one-time investment. When we look at technology, the refreshment of technology is happening in 2.5 years. When we also look at the programming that is done, that is actually happening even before that. In a year or year and a half, we see a framework that has completely changed, and it has actually have a better performance and better outcome that it can reflect to. So cloud computing certainly take care of all of those aspects. Additionally to that, if, for example, I talk about how the healthcare was provided a decade back, if a patient goes to a doctor and the doctor prescribes him certain medicines and there are certain tests that are done, that information could only be exchanged and communicated when the patient physically is present at the clinic. But now, because of electronic medical records, how we at Athancare also do is when the patient calls the doctor, just like a true caller, we let the doctor know, hey, your patient is calling, and hey, here are the records. On a one click, you can access the records. So the moment you start to speak with them, you don't first need them to be physically present. And secondly, you do not need to ask many questions which could already be answered beforehand. So when I look at that, it certainly helps improve the outcome for the patient's health at the time of care, and that care now cannot just be limited to physical care, it is also virtual care. That is where certainly for a small healthcare provider, it has worked immensely, because no matter what the expenses and revenues are, as a healthcare provider, everybody is serving the purpose to make sure that the patients have a better outcome, and there has to be a better approach to see what the problems they are going through. And that's where Athancare also help to assist And that's where cloud computing helps us to basically bring that out from the technology today. When I look at the cost that is associated with cloud computing, I do not look at it in a way that I look at it in a similar way how I look at my electricity bill or my water bill, or maybe rent for the clinic or the hospital where that is allocated. Without having electricity, water, or a place to see the patients, I will not be really able to, give those services. Similarly, we have to agree that technologies is here to stay, and healthcare is actually going to benefit the maximum out of this. And since technology is here to stay, I do not look at it as an expense that is fixed. I look at it as a pay per use, pay as you go, and pay how much you use. The cloud computing has put provisions in place where you are paying for the amount you are using, which is certainly helping us to scale really fast. And it is also making sure that if I am unable to use it to the maximum, then I am just paying a part of that, not the complete amount. So that is where I don't see it becoming a part of the ROI. Rather, I look at it that these are my expenses that are going to happen either way. I am going to pay the rent of the clinic that I am running. So is going to pay a minimum charges for using the technology. And I have to make sure that if I want to take profit, then all my expenses are met. And I can't see a patient without having a desk and a chair to basically put them across to basically understand. I can't go without a stethoscope, so I can't go without a technology. So this is my take on it, and I certainly try to put it away from the ROI aspect. I think there are immense benefits that the patient actually gets out of that. I mean, as I said, that the AI that is actually coming in, it is more consumer driven. It is more focused towards patient. It is more focused towards improving outcome. We have to understand one thing. As a patient, there are two things that are very important to me. How quick can I get better? How fast is my recovery? And secondly, how less do I have to pay for such recovery? What is my expense for that? Now, a recovery cannot happen without having a strong communication with my healthcare provider. And again, I will go back to where I started. Having or being on a cloud computing platform certainly improves my communication and my accessibility with the healthcare provider. That in itself is a huge confidence boost that the patient can have. And the second important aspect is that all these solutions are improving patient experience. We at Athancare are on a mission to make sure that in an hour, a patient can be seen at a clinic by the healthcare provider, get his medications, get the diagnostic test done, and then all he had to do is go back home and rest. We do not want them to go in vicious circle looking for all the medicines from multiple drugstores, looking for a lab to do their test, and then after 6 hours you come back home and then you feel that your suffering has not decreased, it has rather increased. So one of the strong aspects is when I have a way to tell the patient that how long it will take you, at least the patient know how long the tunnel is and where the spot of light is. That certainly help them improve the experience. Secondly, we basically being assisting the doctor in what they prescribe is certainly helping the patient to get the right diagnosis and the right medication with the right dosing. So those are the aspects that the computer is assisting a doctor to do it. Again, I mean, a lot of time how we are also perceived as that, are you here to replace doctors? So for that, I have a very simple answer. If we look at any aircraft that is flying out there today, every aircraft comes with an autopilot. And an autopilot is good enough to take off, and it is also good enough to land the plane. But that does not mean the number of pilots that we require has reduced anymore. it has only increased in number, because technology is again helping a pilot and a healthcare provider in our case in better assistance in taking care of them wearing off fast. Because when you have 1500 to 1800 patients per doctor, the quality of care can only be good to a certain point. After that, you could expect it to deteriorate. But to shift that curve, there has to be the right methodologies in place, right systems in place that could help those doctors achieve such numbers. I mean, at how Sir has described, at their hospital with so many patients coming in, the focus is not to basically continue to bring in the healthcare providers in the door, but to also make sure those healthcare providers are not burning themselves up, and there are solutions out there in place to basically take care of them, and those are certainly directly impacting the patients first before anybody else. So, and I mean, to close it all, where I see that this technology shift is taking the patients to is, from a consultation driven market, we are going towards intervention driven. A patient does not need to know when to go to a doctor, but the system should know when to tell a doctor to speak with the patient to make sure that his health does not deteriorate further, but intervene at the right time to make sure that he actually follows the path of a healthy life. So that's how I see this basically coming into the picture for the users or the consumer market or the patients. So basically at Athancare, our vision is to improve patient outcome at the point of care. So just like how Srini was mentioning about that there are different healthcare providers and every healthcare provider has its own mindset. Some are reluctant towards using technology, and some who are uh, adopting technology, they want to adopt technology at their terms, and some are ready to adopt technology how it is presented to them. So at Athancare, we made sure that we bring the technology close to the doctor. We make sure that we do not give a behavioral change to the doctor, but maintain the same workflow. So with our EMR, so basically what we are building is one of the most adoptive EHR workflow for the healthcare providers. We have to remember, an EHR is a tool for a healthcare provider that they are using for two things. One is improving patient experience, and secondly, to make sure that their clinical practices are going great. So this is exactly where we actually stand. So what we did, we said that even if the doctor is not willing to use the technology, make sure that give him an interface where without even doing a single click on a computer, they are still on a solution platform. So we have a zero behavioral change solution, and we still recommend the doctor to go ahead and write a prescription with the ball pen. But to add to that, we recognize what he writes in real time, and from there we find if there are any drug interactions, if there are any allergic interactions, if there are any tests that are written which are not going well with the reagent that they are putting. So identify those problems and alert the doctor in real time. With that, we also make sure that the single piece of paper of that prescription has now depth to it. We let the doctor tag words with particular videos or text or audio messages that the patient can receive over a WhatsApp for the later purpose to understand their problem and understand their treatment procedures better. So a well-informed patient is better than a patient who has Googled more and learned less, because what he has learned is something that he is not even diagnosed with. But that is a Google diagnosis, which we certainly want him to abstain from. So that is basically one of our primary product. With that, we also provide a queue management solution, a booking platform, a patient visibility, a patient having all the records, doctor seeing all the records. a way to basically make sure that whatever or wherever the touch points are between the patient, the doctor at the clinic or outside the clinic, everything is covered over technology platform to empower them to make sure that their treatment is going in a continuity and they do not find themselves standing by themselves and not having the right person to go to and get the answers for. So this is basically what on a broader level at Athancare we are working on, and this is how we make sure that the clinics that the patient visits now, those clinics are enabled with technology and give them the power to basically stay in touch. And one of the more important aspect that today we see a lot of people moving toward insurance, and with every insurance there are invoicing, there are treatment plans which it requires to be basically put to either the insurance company or to their workplace. So all that is basically taken care at the level of the clinic itself, which is automated, and the doctor or the patient has to do nothing about that.